Under hypertensive disorders of pregnancy, what and all do you know? আগে একটা ক্লাসকে আমরা ডিসকাস করেছিলাম মনে হচ্ছে। Gestational hypertension, very good. Then Preeclampsia Eclampsia, chronic hypertension, আর একটা আছে, very good. বলো, chronic hypertension superimposed on preeclampsia. So what is gestational hypertension? The definition for each is very important. এই চারখানা আছে, চারখানার definition খুবই important. Definition ছাড়া তোকে first question will be definition. Okay, hypertension, gestational hypertension মানে split করে বল।
Hypertension gestation period.
Very good. When will you say it is hypertension?
140/90.
Okay, so the definition is a new onset rise in blood pressure with systolic blood pressure of more than or equal to 140, diastolic more than or equal to 90 millimeter mercury on 2 occasions, 4 hours apart, after 20 weeks of pregnancy in a previously normotensive woman. বুঝা গেল? নেই। So you are measuring, মানে একবার measure করে দেখেছো, BP is 150/90. With that you cannot state it is a gestational hypertension. It should be on 2 occasions. দুবার চেক করতে হবে, and the interval should be 4 hours. মাঝখানে গ্যাপ থাকতে হবে, and it should be after 20 weeks of pregnancy. 18 weeks, 10 weeks একটা pregnant মা এসেছে, if he says his BP is high, we will not classify it under gestational hypertension. She has to cross 20 weeks of gestation. 20 weeks এর পরে gestational hypertension হয়। যদি 20 weeks এর আগে থাকলে what do we call? সকাল সকালে ঘুম পাচ্ছে, we call it chronic hypertension. আগে বিপি আছে তাহলে। So কি ডেফিনেশন লিখেছিস বল? হ্যাঁ, এ তখন লিখেছিস, বল কিছু একটা। হ্যাঁ, হ্যাঁ, in a previously normotensive patient, women. Okay, this is gestational hypertension. To measure the BP, no, you need a criteria. আমরা শুধু BP 140/90 শুধু মানে এ করে দিলে হয় না। We have certain criteria. পেশেন্টকে বসে বিপি চেক করবি না শুয়ে চেক করবি? পেশেন্টকে কি করতে হবে? পেশেন্ট মানে এসে মানে তার সঙ্গে সঙ্গে করতে হবে না। You should wait for 10 minutes, 10-15 minutes. She could have been walking. For that, it might alter her blood pressure. Okay, we will ask her to wait for some time. She should not have any caffeinated products, or she should not smoke 30 minutes before. And what will we do? We will measure the BP in sitting position or lying position. Why lying position? There is something called supine hypertension syndrome. What is supine hypertension syndrome? It is supine hypotension actually, okay. Blood pressure increases on? How? Supine মানে কি? How is supine? Supine is lying straightly. হ্যাঁ, কি করে মানে বলো, গল্প শুনি, বলো। Creative minds, বলো, বল না। If it is wrong, we will correct. কি বন্ধ হয়ে গেলি? Patient is a pregnant patient. Okay, she has a gravid uterus. Uterus একটা mass আছে. She is lying down. Okay, that uterus will compress her IVC. Yes, aorta আছে, IVC আছে. That uterus will compress her IVC. IVC compress হয়ে গেলে কি হবে? কি হবে? venous return কমে যাবে, কারণ নিচে থেকে ব্লাড গুলো যেগুলো আসছে ওগুলো কমে যাবে। venous return কমে গেলে blood pressure will fall. So to prevent that, we will not measure in supine position. We will make the patient to sit. Okay, sit or semi-reclined position. We will measure the BP in the right hand at the level of heart. Okay. And for diastole, you know what is Korokov sound? What is Korokov sound? Sound ache. So we take Korokov 5 disappearance. Korokov 5 এসে গেলে হবে না, disappearance of Korokov 5 we take it for diastole. আগে বলতো Korokov 4, এখন we call it Korokov 5. Korokov 5 we should, disappearance of Korokov 5 we should take it as diastole. Okay, and the BP curve should be ideal. তোমার হাত মোটা আছে, তুই একটা pediatric BP curve measure করলে হবে না। Okay, the bladder length, beefy cluster ভিতরে একটা rubber bladder আছে, the bladder should cover 80% of your arm circumference. There's a criteria for it. Same appropriate size BP curve we should use to measure the blood pressure. Okay, so that is for gestational hypertension. What is next? Preeclampsia and eclampsia. What is preeclampsia?
Hypertension with significant proteinuria.
Okay, what is proteinuria? Only proteinuria? Only proteinuria? Apart from proteinuria, there are features of preeclampsia. There are certain features of preeclampsia. So with this criteria, ekun amra gestational hypertension ekta definition bollam na, new onset blood pressure more than 140/92 occasions 4 hours apart after 20 weeks. With that, there should be proteinuria or there should be features of preeclampsia. How will you say there is proteinuria? Proteinuria mane ki? When will you say there is proteinuria? 300 milligram per 24 hours. 24-hour urine sample, if there is more than 300 milligram protein, we call it proteinuria, or we can calculate ACR. What is ACR? Albumin creatinine ratio. If albumin creatinine ratio is more than 0.3 milligram per deciliter, or if the urine dipstick is more than +2. What is urine dipstick? আগের দুটো হচ্ছে ব্লাড টেস্ট, সরি ইউরিন টেস্ট। ইউ হ্যাভ টু মানে সরি ব্লাড টেস্ট অনলি, ইউ হ্যাভ টু সেন্ড ইট। ব্লাড মানে ইনভেস্টিগেশন দেখতে হবে। বাট যখন একটা এমার্জেন্সি আছে, পেশেন্ট ইজ হ্যাভিং সিভিয়ার হাইপারটেনশন, ওকে, সিভিয়ার হাইপারটেনশন কি আমি বলবো পরে, you will not have time to wait. ওই টাইম আমরা কি করব? বেডসাইড টেস্ট করব। Urine dipstick is a bedside test. What we will do? We will ask the patient to collect her urine in a container. We will have strips, long strips. Urine dipstick, we have long strips. So strips এর মতো মানে square থাকে, segments থাকে. One segment will denote protein, one for sugar, one for ketone bodies. Okay, এরম অনেকটা আছে। You search in net and you will see this strip. Now when we insert it inside the urine, it changes color. If it is green, it is +1. If it is blue sky, if it turns blue, it is 2+. If it is more darker blue, it is 3+. You will see it in the box. একটা container box ই আছে, মানে after inserting, no, the color of the segment will change. পুরো strip will be white only, white color segment থাকে, but নিচে একটা marking থাকে, that is for protein. That protein segment, after dipping inside the urine, the color of this will change from white to green or blue. Understood? This is we do it in 30 seconds. We need not wait for the blood reports to come. আমরা তাড়াতাড়ি diagnose করতে পারি, but there is a thing that shows many false positive. If patient has UTI, okay, if patient has any infection, or if she has any some vaginal infection or something, okay, that time also it can alter. We can use this as a when emergency tool, when nothing is available, we can use. So proteinuria হয়ে গেছে. So what are the features of preeclampsia? Preeclampsia we can classify into non-severe and severe type. Severe type has the features of preeclampsia. Non-severe type BP is more than or equal to 140/90 140/90. In severe type BP will be more than 160/110. If BP is more than 160/110, no, we have to act very fast. We need not wait for 2 hours interval. Okay, after 15 minutes or 10 minutes we can check again, and if the BP is more than 160/100, suddenly we should do something. What should we do? We should give antihypertensives and we should give magnesium sulfate. Why we should give antihypertensives? হ্যাঁ আমি জানি ভাই, হ্যাঁ বিপি বেশি থাকলে কি হবে? Till this no, হ্যাঁ we can leave it now 160/110. Why do we reduce? Why? What is the need? কি অর্গান ফাংশন ড্যামেজ হবে? কিডনির কি হবে? GFR will reduce if BP is more than 160. Kidney function, we will lose the kidney function only if BP is low. Hypotension হয়ে গেলে BP, if it falls, no, then kidney function will get affected because it has renin angiotensin mechanism. Okay, it cannot act. Blood যদি না পেলে GFR হবে না. তুই একদম উল্টো বলছিস. হার্ট রেট বেড়ে যাবে. হার্ট রেট বেড়ে গেলে কি হবে? বিপি বেশি থাকলে হার্ট রেট বেড়ে যায়. আরে বিপি বেশি থাকলে কি হয় ভাই? মাথাটা ইউজ করিস কেউ? কার্ডিয়াক আউটপুট. Why do we give antihypertensives for BP patients? কি হয়? হ্যামারেজ হয়. হ্যামারেজ কোথায় হয়? ব্রেইনে. Okay, brain's capillaries are very small. It cannot tolerate much blood pressure. So it will cause CVA, cerebrovascular accident. Okay, it can cause stroke, or it can cause hemorrhage, or it can cause pulmonary edema. Yes, to prevent this only we give antihypertensives and we give magnesium sulfate. Why do we give magnesium sulfate? Okay, to prevent seizure, or when we have seizure we give magnesium sulfate. Apart from these two, magnesium sulfate has two important functions. One is to prevent uterine contractions, to prevent for as a tocolytic, and for neuroprotection of the baby. So these 4 uses of magnesium sulfate you must know. কি বললাম বল? One is to prevent seizure, one is for treatment of seizure, one is as a tocolytic, one is for neuroprotection. Okay, now what are all the features of severe preeclampsia? I told no, just proteinuria is not the criteria. If we have severe features of preeclampsia also, we call it severe features of end organ damage. End organ damage হয়ে গেলে কি features হতে পারে? So you start from head to toe. It will be easy for you to understand. Okay, আমি বললাম from head there is convulsion, epilepsy হতে পারে. Okay, epilepsy, headache, blurring of vision. ওকে, তারপর চোখ হয়ে গেল, তা আবার নিচে নামিয়ে এসো. দেন দ্যার ইজ হার্ট. হার্টের কি হতে পারে? পালমোনারি এডিমা হতে পারে. আর একটু নিচে যাও, দ্যার ইজ লিভার. লিভারের কি হতে পারে? হেল্প সিনড্রোম হবে, হেল্প সিনড্রোমের আগে কিছু একটা হবে. দ্যার ইজ সাবক্যাপসুলার হ্যামারেজ. ওকে, সো দ্যাট উই উইল হ্যাভ রাইট আপার কোয়াড্রেন্ট পেইন অর এপিগ্যাস্ট্রিক পেইন. ওকে, লিভার হয়ে গেল, তারপর নিচে এসো, কিডনি. হ্যাঁ, রিনাল, হ্যাঁ, renal failure, you should say alteration in kidney function. Okay, creatinine, urea creatinine excretion এর problem হবে, straight away failure হবে না. Then what are all the functions? এই কয়েকটা ফিচার্স হয়ে গেল. দেন তিনটে ব্লাড টেস্ট আছে. ওয়ান ইজ থ্রম্বোসাইটোপিনিয়া, প্লেটলেট কাউন্ট কমে যাবে. অ্যানাদার ইজ LFT, serum SGOT, SGPT will be twice the normal. Then kidney, creatinine will be more. Okay, simple. কি features বললাম বল? From head to toe, head to মাথা থেকে বললাম না. হ্যাঁ, epilepsy, headache, blurring of vision, pulmonary edema, হ্যাঁ, epigastric pain. These are all the symptoms. Okay, patient এসে বলবে স্যার আমার মাথা যন্ত্রণা করছে. If we see her BP will be more than 160-100, ঠিক আছে, বেশি আছে, মাথা যন্ত্রণা করছে, then I will think আচ্ছা she is going to have eclampsia. That is a মানে আমরা তাড়াতাড়ি ট্রিট না করলে she will have a seizure. So I will give labetalol and magnesium sulfate first. If she comes with BP more than 160-100 with epigastric pain, I will think that acha this is not a normal gastric pain, not gastritis, it might be preeclampsia, severe preeclampsia. Understood? If she is coming with breathlessness, I will think acha she might have pulmonary edema. এগুলো ফিচার্স আছে. দেন blood report, blood profile কি আছে? Thrombocytopenia, LFT more than twice, creatinine is increased. What is thrombocytopenia? Platelet than what is normal? 4,000. It is more than 1,50,000. Okay, if it is less than 1 lakh, we call it thrombocytopenia. So if we will see if these features are there or not. Okay, হয়ে গেল preeclampsia. What is eclampsia? হ্যাঁ, there is a onset of tonic-clonic unifocal seizure. Tonic-clonic unifocal or non-focal seizure. What is tonic-clonic seizure? General GTCS আমি জানি, মানে how will it present? Tonic, there is a tonic phase and the clonic phase. Tonic means contraction, clonic means relax হয়ে যাবে. So she will continuously have tonic-clonic. See, okay, this is tonic-clonic. It can be like this. Okay, or it can be a focal seizure. Focal seizure মানে seizure can present like this also, or they will have like this lip movement, smacking movements. Okay, or they can have flickering movements of hand. This is focal seizure. So when your patient presents, no, you should watch them properly. They can present with epilepsy also. If she is constantly blinking her eyes, you should not think acha she is trying to impress me. You should think this in mind. Understood? Then chronic hypertension. What is chronic hypertension? আগে বলেছিলাম. আরে তাড়াতাড়ি তুই বল, তারা বেশিক্ষণ আমি নেব না, না হলে অনেক ক্লাস নিয়ে নেব. হ্যাঁ, when she is having a hypertension before 20 weeks. 20 weeks এর আগে her BP is more than 140/90. না হলে patients who are on antihypertensives, when they conceive, we call it chronic hypertension. What is chronic hypertension superimposed on preeclampsia? Previously she is hypertensive. After pregnancy, how will we know? How will we know if she is having increased BP or not? Features of preeclampsia. Yes, previously she is a chronic hypertensive woman. Okay, after pregnancy she is having proteinuria or features of end organ damage. We call it chronic hypertension superimposed on preeclampsia. হয়ে গেল সারটা? Yes, simple. Now we will see. I told you why we should treat hypertensive. Okay, if it is, even if it is eclampsia or preeclampsia or severe preeclampsia, we have three managements. We have to manage the hypertension, we have to prevent the eclampsia, and we have to prevent the mother and baby. তার জন্য আমরা কি করব, তাড়াতাড়ি ডেলিভারি করতে হবে। either we do induction of labor or we have to do cesarean section. So how will you reduce the blood pressure? What are all the drugs you know? Beta blockers. Okay, the drug of choice is labetalol. How does labetalol act? We have labetalol as tablet form and also injection form. How does labetalol act? তোদের pharmacology তো হয়ে গেছে না, so you must be knowing everything. It is a selective, it is a non-selective beta blocker. It is a selective beta blocker with alpha blocking properties. Okay, so what does it do? Alpha কে block করলে কি হয়? Alpha receptors কোথায় আছে? Vasoconstriction হয়. Okay, and this one beta vasodilation করে. So what it does, it increases the heart rate also by constricting, and it dilates the artery also, and it মানে falls মানে BP কে কম করে. Okay, we have tablets, 100 milligram tablets. Okay, one tablet is 100 milligram, but একটা ampule আছে 20 milligram. This 20 milligram is 4 ml. It's a big ampule. Okay, it has 4 ml. So whenever patient comes, if it is her, if they ask you what is your cutoff to manage, देखो हमारे cutoff होचे 150-100. Okay, our management should be her BP. We should not make it raise than 150-100. আমরা সেরম দিয়ে থাকবো। If BP is more than 160-100, আমি একটা labetalol দেবো 20 milligram IV stat I will give. Okay, after 15-10 minutes I will again measure BP. Okay, if it is again more, next dose I will give 40. If it is again more, next dose I will give 60. Next, if it is again more, next dose I will give 80. মানে whole 80. We should give labetalol like this. And labetalol tablets we can start 100. One tablet is 100 milligram. We can start 100 milligram BD or TDS. We should not give in asthma patients, because asthma it has this receptors, it causes bronchospasm. Apart from this, what do you know? What? Hydralazine and nifedipine. Hydralazine we don't use, we use nifedipine. Nifedipine is a calcium channel blocker. Any calcium channel blocker will cause vasodilation. Because of vasodilation, there is reduced blood pressure. Nifedipine tablet is 10 milligram tablet. Same, we can give it as 10 milligram BD or 10 milligram TDS. ঠিক আছে? Now coming to the eclampsia management. What drug do we give for eclampsia prevention? Magnesium sulfate. সবাই ঘুমাচ্ছিস নাকি? Magnesium sulfate এর কি uses কি বললাম? Tocolytic, prevent seizure, treat seizure, Neuroprotection. Okay, what is tocolysis?
uterine contraction.
When will we do tocolysis? Uterine contraction কে আমরা কবে ছাইবো না? Very good. Premature contraction কবে হবে? 34 weeks এর 37 weeks এর আগে. Ideally 37 is term. 37 weeks এর পরে we want a baby to deliver. তার আগে হলে she will be a preterm baby. Sorry, the baby will be a preterm. So to prevent that, if mother is having a preterm contraction, 37 weeks এর আগে যদি contraction শুরু হয়ে যায়, we can give magnesium sulfate to stop the contraction. We can give nifedipine also. You just know this, but magnesium sulfate we use. What is neuroprotection? Same, when the baby is born as a preterm, it has more chances of intracranial bleed. Preterm babies এর intracranial bleed হওয়ার chance বেশি আছে. So to prevent that also we give magnesium sulfate. How does magnesium sulfate act? Magnesium sulfate is a NMDA receptor blocker. Okay, NMDA receptor block করলে কি হয়? Calcium influx কে বন্ধ করে. Okay, if calcium influx is not happening, there will be no seizure. Seizure happens because of calcium influx. So it acts on NMDA receptor. Okay, magnesium sulfate is excreted by kidney. Okay, how will you administer magnesium sulfate? This is the most important question for you. আজকে ক্লাস থেকে কিছু একটা you have to take something. Okay, this should be first thing. How will you administer magnesium sulfate? IV IM ই দিতে হবে, কারণ this is an ampule. মুখ খুলে মানে should we drink it or what? What sort of answer is this? There is something called Pritchard's regime. Pritchard's regime. Okay, magnesium sulfate is very toxic. আমরা একটা maintained dose আমরা দিতে হবে. Okay, if we give magnesium sulfate more, no, it causes, মানে it reduces urine output, respiratory depression cause করে. So we have to administer it properly. So there is a guy called Pritchard. He designed a regimen how to give magnesium sulfate. Two regimens you have to know. One is Pritchard's regimen, one is Zuspann's regimen. Pritchard, P-R-I, Zuspann, Z-U-S-P-A-N, P-R-I-C-H-A-R-D-T, Pritchard. This magnesium sulfate একটা অ্যাম্পুলে 1 গ্রাম আছে, 1 গ্রাম magnesium sulfate 2 ml. 2 ml has 1 gram magnesium sulfate. Okay, this is 50% magnesium sulfate. Listen this properly. Okay, in Pritchard's regime we give loading dose and a maintenance dose. Loading dose আমরা কি ভাবে দেব? When I say, you repeat with me. Okay, 4 gram of 20% magnesium sulfate IV. বলো.
4 gram of magnesium sulfate
plus 10 gram of 50% magnesium sulfate IM.
plus 10 gram of magnesium sulfate IM.
So আমাদের এখানে 4 গ্রাম, এটা আছে 1 গ্রাম, এরকম 4খানা অ্যাম্পুল আমাকে ফুটতে হবে। 4টা অ্যাম্পুল নিলে I will have 4 gram. Okay, 4 gram straight IV I will give. But this is a 50% solution. এটাকে আমরা 20% convert করতে হবে. I will tell you later how to do it. Okay, so initially we give IV 4 gram of 20% magnesium sulfate IV followed by 10 gram 20%, so 10 gram is 50%, 10 gram of 50% magnesium sulfate IM on each buttock. মানে 5 gram in one buttock, 5 gram in another buttock. 5 gram মানে কত অ্যাম্পুল লাগবে? 5টা। ওকে, 5টা অ্যাম্পুল মানে কত সিসি? ml কত ml? 10 ml. ভাবো 10 ml you have to give in a buttock. So it is very painful for the patient. 10 ml this side, 10 ml this side. total you will give 14. So 4 gram IV হয়ে গেল, এখানে এইদিকে 5 এইদিকে 5, 14. ঠিক আছে, this is loading. তারপর maintenance dose. ঠিক আছে, maintenance dose you will give 5 gram of 50%, same 5 gram of 50% magnesium sulfate in alternate buttock every 4th hourly. ঠিক আছে, সিম্পল। 5 লাস্ট আমরা IM বললাম না, মেইনটেনেন্স লোডিং ডোজের IM যেটা আছে দ্যাট উইল বি সেম ইন মেইনটেনেন্স ডোজ, বাট এভরি 4th hourly ইউ হ্যাভ টু গিভ এন আল্টারনেট বাটাক। এখানে ফর এক্সাম্পল 10 o'clock লেফট বাটাকে দিয়ে দিলে আফটার 4 hours ইউ উইল গিভ ইট অন রাইট বাটাক। তারপর এইদিকে alternate 4 alternatively you have to give 6 doses totally. Okay, so see how painful it will be for the patient. 10 ml 10 ml 10 ml 10 ml 10 ml 10 ml, so there is more chances of gluteal abscess in Pritchard's regime, so they have found Zussman's regime. Okay, সবাই প্রিচার্ডস রেজিম মনে এখন থাকে, আমি মানে জিজ্ঞেস করবো লাস্টে। So magnesium sulfate I have told, this is a 50% ampule. 50% ampule ke 20% how will you convert? ঠিক আছে, 4 gram শুধু IV ডোজটা we give us 20%, IM dose is 50% only. Okay, but if the ampule that we have got it is 50%, how to convert this 50% to 20%? So মানে 4 gram মানে কত ভাইল লাগবে বলো? 4টে ভাইল, 4টে ভাইলের কত ml থাকবে? 8 ml. This 8 ml plus I will take distilled water of 12 ml. 12 ml নিলে কত হয়ে গেল? 20. Understood? So I will take 8 ml of magnesium sulfate with 12 ml of distilled water. It becomes 20%. Okay, this is Pritchard's regime. Pritchard's regime হয়ে গেছে তো? Understood? কিছু ডাউট নেই। Next I will say Zussman's regime. Okay, Zussman's, this is same. Loading dose is same, 4 gram of 20%. Okay, IV. Loading dose is same. In maintenance what happens? We give 1 gram per hour. Simple. In infusion pump, IV infusion. There is something called an infusion pump. Hour. 1 hour. 1 hour e 1 gram jabe. It has a machine setting. Amra we can change it. কত ফ্লুইড যেতে পারে we can alter it. I will set the rate as 1 gram per hour. 1 gram per hour মানে 2 ml per hour. 2 ml per hour আমি সেট করে দেব, then I know 1 gram is going. Understood? না ভাই, this is IV. Zussman's regime is IV regime. এখানে পেশেন্টের খুব পেইনফুল আছে না, পুরো IM আছে, so to prevent that we are giving Zussman's regime.
So loading to IV.
Loading is IV, maintenance also IV, Zussman's है। ডাউট আছে কিছু? যেরকম আমরা IV ফ্লুইড দিই, ওকে, we can give it in 2 ml per hour আমরা দিয়ে দিলে 1 gram per hour যাবে। This is about Zussman's. So what are all the complications of magnesium sulfate? একুনি আমি বললাম।
Painful.
হ্যাঁ?
Buttock.
Okay.
Abscess.
Gluteal abscess.
Not gluteal abscess is because of the IM injection, not because of magnesium sulfate. ঠিক আছে, ম্যাগনেসিয়াম সালফেটের জন্য কি হবে? I told you magnesium sulfate is a tocolytic, so contraction के कमे जाए, calcium influx के it prevents. Okay, if it prevents calcium influx in any muscle, it will cause muscle flaccidity. Muscle cannot work. If the same happens in respiratory system, we cannot breathe. Bhai. Why there will be bronchospasm?
Respiratory distress.
We breathe, বাইরে respiratory muscles আছে না, intercostal muscles আছে. Because of the contraction only we breathe. Yes, intercostal muscles যদি কাজ না করলে it will be very difficult for you to breathe. Respiratory depression. So whenever we give maintenance dose, no, before giving maintenance dose আমি একটা বললাম না 5 গ্রাম আমি দিচ্ছি, তারপরে after 4 hours next 5 গ্রাম আমি দিচ্ছি. Before that you have to check 3 things. One is urine output, you will check patellar reflex, and you will check if the respiratory rate is normal. If urine output should be 100 ml in 4 hours, or it should be more than 30 ml in an hour. I will do Foley's catheter for the patient. In catheter I can see কত output হয়েছে. Last 4 ঘন্টার at least 100 ml থাকতে হবে. 100 ml এর যদি কম থাকলে আমি বন্ধ করে দেব, আমি দেব না. Okay, and I will check the patellar reflex. Patellar reflex I will check. If patellar reflex is not there, brisk reflex, patellar reflex জানিস তো তোরা? হ্যাঁ, মেডিসিনে দেখেছিস তো? If patellar reflex is not brisk, if it is flaccid, I will stop magnesium sulfate. If the respiratory, what is the normal respiratory rate?
12 to 14.
Okay, 12 to 18 only, but if it respiratory rate is less than 16, I will stop magnesium sulfate. Okay, ভাবো হয়ে গেছে, respiratory rate is 10 হয়ে গেছে. What will you do? বন্ধ তো করবি, কিন্তু শরীরের একটু আছে না, হ্যাঁ, you will give an antidote. What antidote will you give? Very good. Calcium gluconate. How will you give? বই দেখে দেখে বলছিস, হ্যাঁ, সামনে বসে proudly you are saying calcium gluconate. Huh. 10, it is 10 10 10. 10% of the calcium gluconate, 10 ml over 10 minutes. দেখো 10% calcium gluconates over 10 minutes IV, 10 ml, 10 ml in 10 minutes. We have to give calcium gluconate. See, 10 ml we have to give over 10 minutes. Mane, it is very slow. Why we have to give very slow? Suddenly if you give push it, no, it will cause arrhythmia. Patient will die only. All my friends during internship, they have did this blunder. Patient got arrhythmia on the spot. Okay, then we had to give this one shock for the patient. So when you come as an internship, you should not do this all. That's why I am telling. You should know what to do and what not to do. Just after passing, now you will think, "Acha, hoye gache, I am the greatest doctor in the world." It is not at all like that. You should. It's a never-ending process. You will learn day by day. So how will you give calcium gluconate? 10 10 10. 10% calcium gluconate, 10 ml over 10 minutes. IV 10 minutes. Simple.